Um, I just want to take this simple video to convey my thanks to Center for International Reproductive Health Training, Africa, for supporting Gulu University Department of Reproductive Health to have this project. The project's name is Section Reproductive Health Resource Center. We've gotten funding for this, and the funding was meant to do a number of things. And one of them is to improve on pre-service education in sexual and reproductive health, particularly in area related to comprehensive abortion care and in area related to family planning. It is also meant to improve the clinical service provision in the two teaching hospitals of Gulu University. That is Gulu Regional Referral Hospital and St. Mary's Hospital, Lacho. It is also meant to improve the visibility of Gulu University in terms of research capacity, output, in area related to sexual and reproductive health. But I think with this funding, we're able to establish a number of things. One of them is actually this solution that I'm using now to have this video produced, and that is our simple audio-visual simulation equipment. In this audio-visual simulation equipment, we expect that in this room, we are going to do the simulation. The students will come and simulate from here. After they have simulated, and then the next room is actually a bigger room where they will actually be able to we replay what we've done from here, and then they watch and see where they have actually done very well, and then we give them credit for what they've done very well. And also where they have not done so well, we actually critique them. That means that we give a positive feedback, an honest positive feedback on where they need some improvement. And they will also be critiqued by their fellows, and this will be for both reproductive health and as well as other disciplines. So this will help a long way in building Gulu University, improving pre-service education. We have also got a number of items that we have supplied the two teaching hospitals, including desktop computers that we have supplied them to improve on data capture. This will help us to actually make sense of the data that actually being produced. And these computers will be installed in the abortion procedure area, where we want to have all the cases that we have here put in a digital format, so that we can now make sense out of if it needs analysis, and it will be easy for us to use that. And also one of the computers will be put in the family planning clinic, so that we get all that into our perspective. We'll actually use that to make sense of it. And this has helped us a lot. We have also installed a number of equipments, including manual vacuum aspiration. We realized in Lacho Hospital they were not using manual vacuum aspiration as one of the tools for evacuating an incomplete abortion, which is a common thing, common admission in that hospital. As well as Gulu Hospital, they had some that were not using, that were not working. So with this funding, we're able to build this capacity for the teaching hospitals, so that students get a feel of the real thing, the real use of an MVA, the real use of other equipment that can be used in sexual and reproductive health, instead of improvising, and then probably they may not get the true feel of how it is used. We're also planning to have a number of training. We already had trainings in building the capacity of lecturers. We've actually now had training of trainer of trainees. We already had 35 people who are trainers, of trainees, and also 35 people who are trained to actually train in this simulation lab. So that means that we will have a number of cohort of people who are able to train in this simulation lab. Besides that, we are also intending to have a value clarification and attitude transformation training tomorrow. So that would actually help us to, tune our value and clarify our value in relation to care of a patient who present with an abortion. Through Child Network, we're also linking up a new project with University of Michigan, and that will be on research capacity building. We think through that we'll be able to build a number of faculties who will actually start doing publication, conduct research, and start doing publication. And this will help improve the visibility of Gulu University. I want to thank Center for International Reproductive Health Training so much for this initiative. Thank you.